Hi, Steve Harden, Chairman and CEO of LifeWings Partners, here with 7.5 tips to help you turbocharge your checklist implementation. Now, in addition to my work with LifeWings, I'm also a captain for a major international airline, hence the pilot's uniform. I have my uniform on because it represents the 35 years of experience I have designing and using checklists on a daily basis in aviation. In addition to my work in aviation, I've also been helping hospitals and healthcare organizations around the world for the last 11 years successfully implement checklists. Now, checklists and using checklists to help reach your patient safety and quality goals is a very popular topic. Some 3,000 hospitals around the world have registered on the World Health Organization's Safe Surgery Checklist website, indicating their interest and their active participation in implementing a checklist in surgical services. Now, you add to this number all of the hospitals that are trying to implement a checklist that haven't registered on the website, and the tens of thousands of units that don't have anything to do with surgery. Emergency department, intensive care units, med-surg floors, just dozens of units within hospitals that are also trying to implement checklists, and literally tens of thousands of organizations around the world are trying to use checklists to improve their safety and quality. Now, one of the things we've discovered as we travel around the world and help hospitals implement checklists is that it's a whole lot easier to introduce the idea of using a checklist than it is to actually get the checklist successfully implemented and used effectively on a daily basis. So here are 7.5 tips to help turbocharge your checklist implementation. Tip number 1. Make sure that your checklist is user-built and maintained. Now, I think the most important thing on the current WHO Safe Surgery Checklist is actually down at the bottom of the checklist, and it says that modification to fit local practice is encouraged. This means that your checklist should be customized to your particular workflow, your workplace, your culture, the way you do business. It's really difficult to implement an off-the-shelf checklist and make it effective in your particular organization. Now, who should be doing the customization? The folks that actually have to use the checklist, that have a part in the daily use of the checklist, are the ones who should be customizing the checklist. This means that you as an administrator should not be customizing the checklist. So get a work team together that's representative of all the work groups that are going to have to use the checklist in your department, and allow them to customize the checklist in the way that they see fit and is going to best work for them. Alright, so you can provide the resources, the time, and the space, and the guidance, but then get out of the way and let them customize the checklist. This will bring you a lot of investment and buy-in because it'll be a tool that they've created and that they've agreed upon is the way they want to do business. Tip number 2, keep your checklist short. Not everything you do in your daily work life has to be on a checklist. I'll give you an example from my work life. The airplane that I currently fly has some 65 discrete steps that I have to do to prepare the airplane for flight. Yet, when we go to run the before start checklist, before we start the engines, there are only 11 things on that checklist, and we can typically do that checklist in less than 10 seconds. Now, those 11 things are what I would call the critical items. They're the things that will not be self-correcting, and if we don't get them done correctly the first time, there potentially could be some damage to the crew, to the airplane, to the passengers. So they're not self-correcting. Therefore, they're on the checklist to make sure that we get them correctly. So keep your checklist short. Not everything has to be on a checklist. Tip number 3, don't confuse your checklist with an audit tool. Now, I have nothing against auditing. I think auditing is very important, but there's a difference between auditing and using a checklist. A checklist is designed so that you have a cross-check on the critical items between one or more members of the team. Right? So it's really not an audit tool. It's more important for you to have the cross-check of the critical items for the overall safety of the event or the procedure or the task than it is for you to have a tick in the in the block. All right, so I would go so far as to say if you have a checklist that has a box on it where you can put a tick mark, I'd take that off the checklist, because it's really easy for someone sitting over in the corner to put a tick mark in a box and pretend that something has been done when the cross-check really hasn't been done. So get those tick marks, those check boxes off of your checklist, and don't confuse your checklist with an audit tool. Number 4, make sure that your checklist has speaking parts for members of the team. An effective checklist is really a trigger for a scripted conversation between members of the team just prior to the procedure, the task, or the event. In other words, you want your team members to talk to one another, and you're going to use a checklist to trigger that conversation. Now, this does a number of things for you. Number 1, it creates mindfulness, right? So if members of the team have a speaking part, they have to pay attention to the flow of the checklist so that they're ready to interject their response or their speaking part at the appropriate time. No one wants to be the one that causes the flow of the checklist to come to a screeching halt. So it creates a level of mindfulness. It also creates a level of personal accountability. Because you have a speaking part and you're going to have to respond about the things in the event or the task or the procedure that you're responsible for, and you're going to have to make this response in front of your peers, it creates a level of personal accountability. You don't want to be the one that says, hey, my equipment is here and it's operational, when it's really not. All right, so if you want a conversation, and you want mindfulness, and you want personal accountability, the way to get that is to ensure that you have multiple speaking parts for the members of your team that are going to use a checklist. Now, tip number 5 is related to tip number 4. That is, if you're going to have a scripted conversation, make sure that you use standardized and scripted language. I'll give you an example of what I mean here. In the current WHO checklist, there is an item on the checklist that says, confirm the patient's name, the procedure, and where the incision will be made. Now, as this is written, this is really too vague and leaves a number of questions. Who's supposed to ask these questions? Who will respond to these questions? And what actions will they take before they make this response? All right, so as you design your checklist, make sure you're very, very clear about who will ask the questions, exactly how they will ask the questions on the checklist, who on the team should respond to those questions, and what language they will use when they make that response. And last, and probably most important, what action or behavior or cross-check must be accomplished before they make that response. So make sure that as you design the checklist, you're very, very clear about who says exactly what and what they're supposed to do before they make that response. Tip number 6, design your checklist as a read and verify, not as a read and do. Okay, there are essentially only 2 types of checklists that high reliability organizations use. There's a read and do and a read and verify. Now, in a read and do checklist, you read an item on the checklist and then you do it. You read another item on the checklist and then you do it. You read the third item on the checklist and then you go do it. This is very time consuming, very cumbersome, and it will bring your workflow to a halt. Right? High reliability organizations use a read and verify system. In other words, they do a whole series of steps with their working memory. Right? So they've memorized the flow, they've memorized the steps, and they just do those from memory. Then at the appropriate time in the process, they stop, take a pause, pick up the checklist, and verify the critical items. Read and verify. So as an example from aviation, as I mentioned, there are 65 things that I have to do to prepare the airplane for flight. There are almost as many things that the co-pilot has to do to prepare the airplane for flight, and at the appropriate time we're going to take a pause, run a checklist, and there are only 11 things on that checklist, and it takes us less than 10 seconds to do it. So it's very time efficient. So make sure that your checklists are designed as a read and verify, not a read and do. Tip number 7, make your checklists physician-led. In other words, if your checklist involves a physician in any way, the physician should be the one leading the checklist. I'll give you an example from my world. As the captain of an airliner, I am responsible to make sure that checklists are started and completed. Checklists are normally run in the cockpit when I ask them to be run. I'm the one that designates the checklist to be started. Right? So I don't physically have to run each checklist, but I'm the one that calls for the checklist. Right? So I use the checklist. Captains use the checklist as a tool to manage the workflow and to manage the crew. That's how all high reliability organizations do it. Well, the same principle holds true for healthcare. If your checklist involves a physician, in the case of the OR, if your checklist should involve a surgeon as the team leader, the surgeon should lead the checklist, right? The surgeon is going to use the checklist as a tool to manage the workflow and to manage the surgeon's team in the OR. So make sure that your checklists which involve a physician are actually led by the physician. Tip number 7.5. I think this is a bonus tip. It's one of the most important tips that I can offer you. Make sure that anyone in your unit or your organization that's using a checklist also gets really effective, really good teamwork and communication training. Essentially what you want to have here is every single person that's involved in the use of a checklist must be able to speak up, make an assertive statement, and use stop-the-line language. Your greatest predictor of clinical excellence is the ability and the willingness of your staff to hold one another accountable to a standardized way of doing things, which is what a checklist represents. Another way to look at this is a checklist is really a technical solution, right? It's a standardized way of accomplishing a task. It's a real fallacy to think that a technical solution is going to solve what is essentially a social psychology problem. That is the unwillingness or the inability to speak up and make an assertive statement and hold one another accountable. Right? So in order to make sure that your folks can speak up and use stop-the-line language and stop-the-line mentality and hold each other accountable, you have to give them great teamwork and communication training. And it's where you marry the two. You've got a really good checklist, a really good technical solution, and you've got really good teamwork training, and you put those two together, that's where the magic of a checklist happens. So if you're using a checklist, make sure that the folks who are using the checklist get really good teamwork and communication training. Well, there you have it. 7.5 tactics, tips to turbocharge your checklist implementation. I encourage you to try any and all of these steps, and I think you'll really see your checklist implementation become more successful, and it'll really speed you along your way as you reach your patient safety and quality goals. Thank you.